For my medical report, I was an ER doctor at St. Francis Hospital in Tulsa, Oklahoma. My patient's name was Brandon Priest, and his date of birth was 5/16/44. He was a Caucasian male, and he came into the emergency room complaining of sharp pain in the right lumbar region and had difficulty sitting comfortably. He also complained of painful urination. The patient's history consisted of high cholesterol, hypertension, and hyperparathyroidism. I examined the patient and noticed a slightly elevated temperature along with some hypertension. Other than that, the heart, lungs, and bowel sounds were normal. I palpated his back in the right lumbar region. I noticed it was slightly swollen and tender, and I asked the patient to describe the pain, and he described it as sharp and isolated. So I decided to do some exams. The first was a blood urea nitrogen test. The next was urinalysis, and I also decided to do nephrosonography and nephrotomography to see if there were kidney stones. In these exams, I found high levels of uric acid, calcium, and creatine in the blood. The urinalysis also showed hematuria. The nephrosonogram showed a single large nephrolith in the renal pelvis of the right kidney. It also showed slight nephromegaly of that kidney. The nephrotomogram showed the nephrolith was approximately 2,500 millimeters in diameter, and it was partially blocking the ureter. With all these findings, I diagnosed the patient with nephrolithiasis causing obstruction of the ureter. Because of this, I decided the patient needed a pyelolithotomy as well as pyeloplasty. I decided to call in the nephrologist, Dr. Avery, and assisted her in the surgery. In the surgery, we placed the patient under general anesthesia and placed a catheter to drain any remaining urine in the bladder and urethra. The patient was placed in a jackknife position, allowing Dr. Avery to approach the kidney posteriorly. She made an incision between the 11th and 12th rib and made it towards the sternum. Once the kidney was isolated, the ureter was dissected and followed to locate the renal pelvis. Then we made a large incision in the kidney to isolate the nephrolith, and it was dissected out and removed using forceps. The kidney was washed out to remove any remaining fragments, and then Dr. Avery repaired all the damaged parts of the renal pelvis and the kidney with sutures. The procedure was then completed and the patient was closed. In the end, I diagnosed the patient with nephrolithiasis, resulting in emergency procedures, and I then recommended the patient see Dr. Avery, who would then monitor him for the next few days, as well as discuss any nephrolith prevention and procedures that he may need to have in the future.